My full name, Connie Brennan. My job title is Aesthetic Nurse Specialist, and the name of this organization is Lifetime Fitness. I have 3 practices: Mesnoplastic Surgery, MMK Plastic Surgery, and Lifetime Fitness. My industry is plastic surgery, and the subtitle of that industry that I work in is non-surgical aesthetic medicine. My 3 locations, 2 of my locations are in Edina, Minnesota, and one of my locations is in St. Louis Park, Minnesota. How I got started in aesthetic medicine is really kind of an anomaly. I really enjoyed photography as a youth and retouching photos and lights and shadows of art. And I went to school as a medical assistant and was recruited by a plastic surgery company. Back in 1988, I started working in plastic surgery as an operating room assistant, and then I went back to nursing school during that time while working in the operating room, and graduated in 1994 and started working with injectables at that time. So this career that I have been in for 26 years has been a real blessing. I love the idea of helping others, and I have a true passion for that. And in my industry, I get to help others every day achieve their maximal beauty. So for me, it's not even working each day. It's really going to work and playing and helping women and men look their best. So I wear multiple hats. In this company, Lifetime Fitness, I wear the hat of the Medical Education Director. I have a team of nurses that I work with, continuing their education, developing courses for our Center for Advanced Aesthetics. And I also spend quite a significant amount of hours in clinical practice here, injecting faces with dermal fillers and neuromodulators. In my plastic surgery practices, I work as their nurse injector, injecting faces and maximizing beauty. And then in my own training company, Aesthetic Enhancement Solutions, I spend hours training other nurses, physicians, and PAs in the art of aesthetics and injectables. My greatest professional inspiration, I would say, are my clients. They push me to be better at what I do. They ask tough questions. They all bring new challenges with their faces, symmetry, harmony, proportions. And so in strive to offer them the best outcomes I can, they inspire me to continue my education, to pursue knowledge, and to be the best that I can be for them. Providers starting out in the aesthetic industry, as I travel across the country and work with them, one of the most difficult questions I'm asked is, how do I get started and what should I do? And my advice to them is to pursue knowledge, to get the best training that you can get, to connect with other providers that are good at what they do, because everything that you learn will transpire through your hands into patients' faces, and the outcomes are the most important thing for patients, meeting their expectations. So education is key, and that it will give you power. Knowledge is power. The adage, I feel, is very, very important.
Hey Roxanne, this is Connie Brennan returning your call. How are you?
I think for the consumer today, ultimately it's very confusing as to what provider to choose. How do they find the provider? How do they get the information to make a good choice? And aging is really hard on people in multiple ways, whether it's health of our bodies, wrinkles on our faces, tooth decay. There's a lot of things that go along with aging. And so because of aging, medicine has progressed where we can treat so many things. And a symptom of aging is wrinkles. So being able to treat wrinkles or deflation, volumization in the face, volume is really a big thing that we're talking about right now, because patients come in and they have a wrinkle, nasolabial fold wrinkle, and they want that treated. And a lot of times this is a symptom of deflation or fat or bone loss in the face. So we're looking now more at a 3-dimensional type of work with aesthetics versus 2-dimensional. And so for clients to find the potential provider that they want to see who has experience is, how do they go about doing that? And a few questions that they could ask when they make phone calls and do their due diligence is, do their research. Has their provider been around for how long? How many patients does this provider treat each day? What are their education and background? Look at their credentials. There's so many things that you can find out about your provider before going in to see them. So ask the right questions before you get there so that you can get the best outcome.